Welcome everyone to today's webinar hosted by Prevention Plus Wellness, LLC, located here in beautiful St. Augustine, Florida. My name is Dr. Chudley Wirch, and I'm the CEO at PPW. And today's topic, as you can see, the behavior image model. I'm going to take us back to the beginning, to the roots of all of our integrated brief motivational programs, and the model that we created that serves as the basis for understanding and developing these programs is sort of a synergistic strategy. You develop a model, you develop a program, the program helps inform the model then helps inform the program, and back and forth. And things have changed over the years, but there's still a core basis for this theory. And so that's why I think it's really important to have everybody understand this. And I know not everybody's interested in theory. I know you really are, many of you are practitioners, but theory is the basis for and serves as a solid foundation for, for effective practice, put it that way. So theory sometimes gets lost because there's so much emphasis on practice, there's so much emphasis on evidence supporting practice, but theory is that third part, that third essential part as well. Theory, research, and practice, all very, very important. So we're going to be talking about the behavior image model, sometimes referred to as BIM, and it is a guide for brief motivational interventions that integrate multiple behaviors for youth and young adults, single session programs. So lots of content, 3 objectives for today. We are going to discuss the need for brief motivational and integrated programs for youth and young adults. Secondly, we're going to review the components of the BIM, the behavior image model, as well as the practice part of this, which is the PPW program logic model. Oftentimes you have to have a logic model to understand, how a program may work. If you're asking for funding for a program, they'll oftentimes ask for a logic model. All these things are in this webinar, in these slides, which I'll be sending you, but they're also on our website, preventionpluswellness.com. Third objective for today is we will look at the research and evidence supporting the behavior image model, BIM. Okay, so let's start first. And by the way, just to let you know, everybody who's registered today will receive a PDF of these slides. Everybody will receive a link to this recorded session. So no worries if you missed it or if you got to leave early. And everybody will get a CE certificate for 1 hour CEU if you are viewing. And so I hopefully that helps everybody. As we go along, if you have questions, if you have comments, type them in the chat space or the Q&A space, and I'll address them at the end. So here we go. Lots to cover. Why brief motivational interventions? Why are these important? Number one, information and education alone is not effective. If your goal is to motivate behavior, and I think most of us, the goal is we want our participating youth, young adults, and adults to change, to decide to live a healthier lifestyle, avoid substance use, engage in healthy behaviors, make good choices, if you will. And if you give them information, if you give them education, that alone is not effective in changing behavior. If you don't believe me, just look at the many, let's say, for example, healthcare providers that still smoke cigarettes. This one, quick example. Number 2, brief interventions can be provided where longer term interventions that may be 8 or 10 or 12 or 15 sessions can't be. So you can really increase the program reach and the number of settings. And this is particularly, I think, important and relevant during this pandemic. So brief interventions, by the way, there is no single definition of what a brief intervention is. Some I've read, some have said it's 6 sessions, some 4 sessions. Most prevention plus wellness interventions are just a single session. Number 3, brief motivational interventions like SPURT, screening, brief intervention, referral to treatment, are evidence-based practices. So you can feel comfortable that they have some evidence support. That is brief motivational interventions. And number 4, they can be more cost-effective in influencing behavior change. Why? Well, it just took 1 session. I mean, there was a situation where some providers, prevention and health providers in California were telling me they were going out throughout their county and providing this free drug prevention program, this 6-session program, and saying they were really thrilled about the fact that it was free and it was saving them all this money, but they weren't taking into account their travel and their time, and over 6 sessions. So you've got to take into account the cost effectiveness. If a program does cost you something to purchase it and being trained, but it's only a session in length, that can save a tremendous amount of time and energy and resources. So these are just a few things about why it's important to have brief motivational interventions. Now, why is it important to have integrated interventions? Number 1, most youth experience multiple health risks, not just substance use, and multiple substances, as you know, e-cigarettes and marijuana, obviously underage alcohol use, opioids, etc., but also a risk for chronic disease and mental health problems, not enough sleep, poor nutrition, inadequate physical activity, etc. So all these things are going on at the same time. Youth individually and as a group are experiencing multiple risks for substance use, for chronic disease, for problems related to physical and mental health. Number 3, integrated interventions may increase the breadth and size of behavior effects. It only makes sense if you're addressing, let's say, alcohol and physical activity. You may have outcomes on alcohol and physical activity versus if your program is just addressing alcohol prevention. Okay. Number 4, can be more cost effective than single programs because you're addressing multiple risks. Number 5, allows addressing multiple health problems simultaneously. In other words, within a single intervention, greater public health outcomes. And lastly, very important, we found over the years that parents and youth and providers are much more likely to embrace, to engage, to enjoy programs that address more than one risk factor. Okay, so that's why, some of the reasons why it's important to address. And why should we have brief motivational integrated programs? Putting these two together now, well, it allows the benefits of both, the benefits of brief motivational interventions plus the benefits of integrated interventions within a single program. And that's what prevention plus wellness programs are. They're brief motivational integrated programs. We're going to look at the theory here right now, as a matter of fact. And we'll start with the underlying model, the underlying theory, which is the BIM, the behavior image model. Now, for some of you that have been on some of our previous webinars, you've been introduced to BIM, or perhaps you've been trained in some of our programs. BIM is the theoretical map that can be used to develop brief programs, or if you want more extended programs. But the key is BIM is a map for using image to connect health promoting behaviors like physical activity, nutrition, sleep, stress control, etc., with substance use avoidance or prevention. So for example, the BIM can be used to link promoting physical activity with preventing alcohol use. The link below goes to the article describing the behavior image model, which was published, I can't remember when it was published, a number of years ago, but if you want to read the entire article, there it is down below. And remember, I'll be sending you these slides. Now, there's 3 components to the behavior image model. The first component is the need to communicate positive, aspirational, peer or social images, as well as future desired images as a benefit or as a value. And then substance use as harmful or costing, is that a word? Or as a cost to those positive images and benefits. So that's how we link. So it's that coupling, if you will. And this kind of communication, positive, aspirational, peer, social, future image, and then linking substance use as harmful, is the tool to connect and to increase motivation to change diverse health behaviors, not just substance use, but increase the protective healthy behaviors. So that's the first main component. That's the motivational component to BIM. The second component is the action piece. It's if you will, taking advantage of the increased motivation from that type of positive aspiration communication by initiating action or behavior change among youth. And that's number two, using multiple behavior goal setting / contracting. Why? To initiate behavior change and over time to increase self-control or self-efficacy. I should say self-control or self-regulation, as well as self-efficacy or self-confidence, and improve their self-control. So step one, motivation. Step two, action. Now, the third component of BIM, behavior image model, is more recent, or we've sort of developed it more recently. And that is, you want to then support your participating youth, young adults, or adults, in fact. And you can do this in a number of ways. If they're youth, you can provide parent materials and training. You can provide resources and opportunities, anything that would support the positive behavior choices that were made by your participating youth, parent-youth communication to support those changes, and youth monitoring and continued behavioral goal setting over time. So really important to continue to support for that youth behavior change. But the key components, the first two, communication, positive image, communication, and action, goal setting, and then you're off and running. Okay, those are the components of the behavior image model. Underlying the behavior image model is message framing. It's how you frame or state your communication to your target population. And underlying this is a theory called prospect theory. And this theory says that information presented in terms of either positive gains, in other words, benefits, or negative losses, or other words, costs, can influence health behavior decision-making differently. And most of the research highlights the importance that positive gain benefit messages are more likely to be effective than cost or loss messages. What's interesting about that, of course, is most of our prevention and health and medicine, public health communication is really all about losses. It's about costs. It's about risks. And yet, prospect theory, most of the research supporting this, says positive gain messages, benefits messages are likely to be more important. However, there's some research showing that if you present both benefits and costs, or gains and losses, then you'll be able to reach a broader audience. And that's really what the behavior image model has embraced, providing messages that promote benefits and messages that is particularly regarding the healthy behaviors, benefits, outcomes, images, and then how substance use is a cost or results in loss of those outcomes and those healthy behaviors. So, okay. If you don't believe me, take a look at the alcohol industry. And what do you see here? You see lots of positive images there. We're linking a substance, a certain type of a beer, to these positive images, healthy fitness. Okay, if we can do that for beer, we should be able to do that for the lifestyle of young people. Now, what's the support for targeting images, generally speaking, in programs or interventions? Well, there's three very powerful sources. Number one, plenty of conceptual support. In other words, theoretical support like possible selves theory that has identified and listed image as a main contributor to decision-making about health behaviors. Number two, plenty of research and research in different areas, research on self-concept, prototype images, possible selves, positive identity, all showing the importance of image, either images of self-images or self-concept or all those related concepts as being really important to health decision-making. Thirdly, and you can see again the image on the left there, and that is marketing and advertising companies for decades from the beginning of the industries have and continue to use positive and appealing images to sell products, indicating that it's a very powerful strategy. They're not showing negative images or costs or losses. They're showing how, in this particular case, this beer results in and is associated with these healthy, happy, beautiful young adults or young people. Lastly, asset-based focus is associated with positive youth development. We're much more likely to focus on risk-based messages in prevention and in medicine and public health, et cetera. But I'm saying asset-based messages could, benefits messages could be more effective. Not only that, but they're more likely to be embraced, to be accepted, to be interesting to organizations, to youth, to parents, et cetera. So there's a real advantage to focusing on wellness, habits, and outcomes in your prevention messaging. So other content about images related to health behavior. Research supports the importance of addressing what's called a prototype, or if you will, a stereotype in predicting health promoting behaviors like exercise. Plenty of research in that area. There's research that shows that future images of an individual, yourself or your youth, of themselves in the future, or a possible self, as sometimes referred to, very important to predicting their behavior. And processes of comparison, social comparison, self-comparison, very important. In other words, I compare myself unconsciously to a prototype of a peer. What a healthy, physically active peer look like, and I can compare myself to them unconsciously, or I can compare myself to a future more fit person. And those comparisons are believed to be key mechanisms in action in explaining why focusing on images can be an effective strategy for changing behavior. So for the BIM, one of the interesting concepts came up with it was this idea of coupling behaviors. And particularly in BIM, what's important is coupling divergent behaviors, especially coupling a health promoting behavior with a health risk behavior, particularly substance use. In other words, you can couple physical activity with avoiding alcohol or marijuana use. And the assumption here is that to achieve optimal health, personal performance, to maintain health and reduce declines, we really need interventions that address health risk and health promoting behaviors across the spectrum, across our lifespan. It's not enough to address just vaping. It's not enough to address just physical inactivity. We must address multiple things because these are so common for all youth and young adults and even adults. And it's a much more holistic approach, taking into account a broader array of health behaviors. So number two, behavior coupling is this comparison, either conceptually or empirically or just logically, drawing this relationship between two health behaviors. And the opposing behavior couplings are just what I said. It's where you couple a health risk behavior like e-cigarettes as being weakening or counteracting the gains of a health promoting behavior like sleep, which leads to reductions in health and personal development. And then secondly, avoiding those substances, those risk behaviors, really important to maintaining performance and health over time. Okay, that's what coupling is about. I know this is theory. I'll send you these slides. You can look at it. And I'll give you some practical experiences, examples here in just a minute. Goal setting, that's that second part. We're talking about the action piece, really important. And the relationship to image is this. If you give youth or anyone or ourselves, just say, hey, I'm going to set goals in any part of my life. The problem is research shows that it's often goal setting fails. This is the box in the middle there, fails because personal goals fail because they were adopted for external reasons. Somebody told me to, somebody wanted me to, somebody asked me, instead of reflecting on their personal interests and values. So this is where that first box right on the top comes. Self-image is so important. If you ask somebody to think about their self-images, self-concordant goals means that their goals are linked to their desired images, either prototypes or future. And if you can have a young person think about what their images are, desired images of themselves in relation to desired others or future, then that will identify those images as values, and that's the basis for goal setting. That will lead to much more productive goal setting, goals that will be set and will be committed to and achieved over time. So that's what we're talking about, linking goals to images, very important to success of the goals. Now, if we take a look at models of brief intervention, there's three we're introducing today. There's an article that said there were two main types. Number one, the tailored or teachable moment. This is the type of a brief intervention where you go into a medical setting, a physician's office, or you see a nurse and they ask you about your alcohol or your tobacco or something. And they then provide you, some assessment and some recommendation. It's a teachable moment. It's an opportunity to address that risk behavior. A second type of brief intervention is the counseling, the individual needs type, like a motivational interviewing. It's time limited, it's patient-centered, it's open-ended. The third type that we'll be discussing is the behavior image model. That's a brief intervention model, a unique model all of itself, and we've been talking about it thus far. So there's three key models, three broad models as we're presenting them for brief motivation: the tailored teachable method, the counseling individual, and the behavior image model. The behavior image model, as an evidence-based practices, screening and brief intervention, has these three steps. Screen participants for their current health habits to increase their awareness of their health habits. Number two, provide feedback using positive image messages. That's what we described through the BIM. Using your script and your PowerPoint slides, which are provided in all Prevention Plus Wellness programs. And your content, your feedback integrates behaviors to increase motivation for change, integrates physical activity, nutrition, sleep, stress control, with avoidance of alcohol, tobacco, other drugs. Thirdly, assisting participants in setting and monitoring goals over time to increase multiple healthy behaviors and increase self-regulation and self-efficacy. So those are the three steps: screening, feedback, and goal setting. Those are the steps to the behavior image model based on prevention plus wellness logic model, actually, which we'll be coming into based on BIM. Now, there's similarities, but there's differences between typical brief interventions, which are shown on the left-hand side. And I know this is a little small, so I'll read it all for you. And the BIM interventions on the right-hand side. So if you look at typical brief interventions on the left, they typically target just a single, usually a risk behavior, alcohol, tobacco, marijuana. They screen for determining risk level and tailoring messages. They use risk-based content, focuses on feedback regarding personal or normative risk impairment, provides advice and change options, can involve unstructured client-centered interview, provided also during teachable moments or opportunistic events like in an emergency clinical setting, and it results in single behavior outcomes. That's your typical brief intervention model and programs. To the right, the BIM, and just take, for example, our evidence-based sport prevention plus wellness program as one. This is what you have in brief interventions like sport based on BIM, targets pairs of health promoting and health risk behaviors, screens to personalize messages. It uses image-based content. It provides health promotion and health risk behavior gain and loss frame messages and feedback, provides recommendations and goal setting, involves a structured scripted protocol, provides without regard to opportunistic settings, so it can be provided anytime, and may result in multiple behavior outcomes because it focuses on multiple behaviors. So that's the comparison of typical brief interventions and brief interventions based on the behavior image model. A little bit more about self-control. Behavior image model is also a self-control model. PPW programs based on behavior image model provide feedback on health behaviors and their images. And then youth participating, you can see this discrepancy. Well, I see that I'm not getting a lot of physical activity, and yet physical activity is associated with these desirable future images. And so setting a goal to increase physical activity a little bit could actually improve how I look and feel, and that's an important value for me. That's how the behavior image model links images to goal setting. Goal setting includes avoiding substance use and increasing wellness habits. So it's a dualistic approach. It's rather than just focusing on a single behavior. Another way to look at this from a programmatic perspective is this integrative, interconnected model for promoting youth overall wellness. So you start in the left with the blue ball, that's substance abuse prevention. You go down to the green ball, that's health behavior promotion. And these two together, substance abuse prevention plus health behavior promotion, and you can go follow that arrow to the right, gives you the great big red ball, which is improved mental and physical health. So by addressing substance use prevention and health behavior promotion, you're much more likely to improve physical and mental health. And by doing that, that also makes it easier to address substance use prevention and promote healthy behavior. So it's a synergistic model. It's a circular influencing model. The way to look at this from a practical perspective, and I know, again, some of you may have seen this before, is, again, following that three-step behavior image-based screening and brief intervention practices strategy found in all prevention plus wellness programs. Screen youth for their current health behaviors. So, for example, here's some examples of some of the screening questions used in, I think this is the sport prevention plus wellness program. You know, sports and physical activities and nutrition and breakfast and sleep and obviously alcohol or other substance use. Then providing brief positive messages, feedback messages, which integrate wellness and substance use. And the goal here is to what we call trigger or cue unconsciously images of young people, particularly of themselves in the future, desired future images. This is going to increase motivation for change. They're going to compare their behaviors to a desirable future image and behaviors. And you do this by linking the positive images and outcomes of a health enhancing behavior like physical activity, saying that this, young people like yourself who engage in regular physical activity feel energetic, sleep better, look more active, fit, confident. Those image terms are underlined. And the other outcomes that are not underlined include sleeping better. So these are both image and non-image benefits. And then the second part of that messaging is linking how substance use, in this case, marijuana, is just going to be, it's going to be a loss. It's going to result in costs for you. It's going to prevent you from achieving your fitness goals of being in shape and looking good and feeling fit and active. So that's the process for communication, for feedback. And then goal setting is that third part. And prevention plus wellness goals have all of these components to them. It's not just having youth set a goal, but it's having youth pledge or identify substances to avoid, a wellness behavior or behaviors to increase, having a signature and co-signature to increase motivation, calendar log to increase chances of monitoring. So there's quite a bit involved in this goal setting to really increase success in goal setting. But the key, that motivation piece, is really important. That's the feedback. That's the behavior. That's the image, behavior connections, the coupling of the healthy behaviors and the substance use to increase motivation. If you give youth, a goal to set, the chances are that they're not going to follow through with that goal. They got to be motivated first. So the behavior image model and PPW programs go beyond positive images. Why? Because there isn't a silver bullet. There is no one approach to preventing or changing behavior. Images can be particularly effective for many youth, but for some youth, they're not going to be. So how do we address this? Well, number two, we have non-image positive outcomes. That's the first thing. So we include not just images, but also other benefits like sleeping better. So expectancies, increasing the number of positive expectancies is very important. And then thirdly, addressing other risk elements, other risk factors we know influence substance use, like making sure there's communications in PPW programs about perceived harmfulness of substances, social norms, trying to correct the fact that kids, they overestimate the number of their peers think they're using, common myths about substances. All of these are addressed in PPW prevention plus wellness programs. Improved body image is what we've seen coming out of PPW programs. Now, you are addressing to a certain extent appearance images, and this can end up causing some discomfort for some youth. So we address this, and we don't want youth to engage in any unhealthy behavior. And we want them to understand that body image, we want them to have a healthy body image. So that's why all PPW content is about feel-good images, a variety of healthy looking youth of different ethnicities, ages, activities, body shapes. Focus on healthy habits. And fit does not mean being perfect, a really important message. And research has shown PPW programs results in improved body images, so very positive outcomes. Now, let's shift from the behavior image model, which is the conceptual basis for these brief motivational integrated programs we call prevention plus wellness. And let's look at the prevention plus wellness logic model. Okay, so this is it right here. The link in the bottom will take you to the actual model on our website, so you can read it a little bit easier, but I'm going to walk you through it, or at least some of it. So you go from inputs to outputs to outcomes. You're going from left to right in this particular model. So let's take a look at the inputs. What's involved in the initiating the PPW programs? Number one, you have a program manual, or in one case, the sport program, we actually have one program sport in a video format. Most of our programs come with a digital download, PowerPoint slides, and all of the program materials. These are all things you need to initiate the program. Number three, we have online and on-site program implementer training workshops, very important, but we also have optional train the trainer and even parent training programs if you want to train parents to implement PPW programs at home. Number four, you have program implementer support from us by email, by phone, by online. We can hop on Zoom anytime, when we really try to emphasize helping you as a provider implement your program throughout the life of the program, and for as long as you need us to support you. Online and paper pre-test, post-test surveys, instructor surveys, fidelity checklists, evaluation support, so that you get the data to inform how well your program's working, to promote your program and to improve your program. We feel that's very important, that data-based decision-making. That's why we build in those free evaluation tools. Number six, program tailoring and program promotional support materials. We want you to promote your program. We want you to get visibility. We want you to be, and that will help get broader reach. And in some cases, you may need to tailor your program. So for example, In Shape, Prevention Plus Wellness, was made for college students. It's now implemented in college settings and community settings, but we needed to make a slight adaptation to it when we applied it to US Air Force. Okay, so it can be done, and can be done rather efficiently too. So that's the input. In terms of outputs, you've got screening of current substance use and healthy behaviors. Number two, you've got feedback on healthy behavior benefits images, and then that's coupled with substance use costs and substance use harms, social norms and myths. Three, you've got recommended menu of multiple health behavior goals to set and monitor, and substance use to avoid, with signatures and co-signatures to increase motivation. And four, follow-up strategies. Follow-up strategies could just be re-implementing your PPW program every 6 to 12 months. It could be repeating goal setting every week. It could be using the parent flyers that we have in some of our programs and our sport programs. It could be getting parents trained. It could be adding additional PPW programs. So for example, providing sport PPW one week, vaping PPW another week, marijuana PPW another week, or using our Sport 2 PPW program, which has 6 additional lessons. So you can actually have many lessons if you want to. So that's the output. That's the outputs in terms of activities. In terms of outputs, participants, all youth. So sometimes, because we have a program called Sport, some providers will say, oh, this is just for kids in sports or for athletes, youth athletes, but it's not. It's for all youth. We've got programs for elementary school age, middle school age, high school age, young adult age. So we've got the whole spectrum of age 8 to 25, and some of our programs have been adopted for use with older adults as well. And all young people as well as high risk. So many of our programs are implemented to substance using adolescents or young adults. Not a problem. In fact, research shows actually greater effect sizes for providing PPW programs to populations already using substances. In terms of outcomes, you got short, medium, and long. In the short term, we expect to see increased awareness of positive images and other benefits of healthy behaviors, increased awareness of how substance use behaviors can interfere with positive images of behavior achievement. Number 3, increased peer and future self-comparisons. Number 4, increased awareness of the discrepancy between the youth's current health behaviors and desired peer and future images. Number 5, increased multiple behavior goal setting. And lastly, 6, increased parent positive behavior image communication. So that's the immediate short outcomes. Medium term, changes in efficacy, self-efficacy, and goal setting, and intentions, and peer influenceability. I'll let you look at these yourself when I send you the slides. And then long term, we really want and have found through the research that PPW programs have an impact on multiple behaviors, not just substance use, and multiple substances, even though maybe a sport program, for example, that addresses only alcohol, found to be effective also for reducing tobacco and marijuana use and increasing physical activity. So you've got multiple health behaviors influenced over time with our programs. There's also some model assumptions and some external factors, which you can look at. Here's a simplified version of the PPW program logic model. Communicate behavior image messages, which integrate healthy behaviors with substance use. That cues an unconscious positive future desired image, wellness image of themselves. This increases awareness of wellness images, benefits and values, and how substance use is undesirable and costs them. And that enhances motivation to set multiple behavior goals, and setting and monitoring goals leads to behavior change, greater self-efficacy, and self-regulation skills over time. How about the research? What's the evidence for PPW programs? So for sport, there were at least four publications finding different outcomes, and these are the different journals, and you can click on those links to read more, either the full article or at least an abstract. And these are the different types of outcomes across those studies: multiple substance use prevention and reduction, increases in physical activity and other healthy behaviors, effects even a year after a single session, parent communication increase, effects even of PPW flyers that are in the sport program. And lastly, when sport was translated into Turkish language, it was found to be effective across multiple health behaviors, even in a very different culture in Istanbul as compared to US culture. So highlights, I think, the robustness of the behavior image model. Then there was research, and there was just a brand new study published under number 5 in Preventive Medicine Reports, supporting the multiple behavior outcomes from InShape, which is our young adult program. And again, many different outcomes of preventing different types of alcohol use, including heavy, dangerous use, including heavy use of marijuana, including drinking and driving, etc. But not just that, improving other health behaviors, physical activity, sleep, even health-related quality of life. That's why sport and InShape are on evidence-based registries, like some of these, like Blueprints for Healthy Youth Development. But we had also some other studies using behavior image model, other interventions, and these were published in other journals. And here's some of these other outcomes. And so you can see, again, multiple behavior outcomes for youth, for young adults, across nutrition and exercise and alcohol and marijuana, etc. And another bit of evidence is that we have got PPW programs in all 50 states and abroad. And in all of these settings, in schools and out of schools, and faith-based, and homes, and juvenile justice, and US military, and counseling, just about anywhere. So this, I think, shows you the potential for reach, public health reach, for these brief motivational integrated programs called Prevention Plus Wellness. We have a good number of success stories we post on our website. They're case studies, if you will, of the outcomes. So you can check those out if you'd like. And we have many programs that have been developed based on the behavior image model. These are just the ones, some of the ones that we're offering right now. There have been quite a few others, and all of these have, have shown that the behavior image model can link healthy behavior promotion and development with avoiding risk behaviors, whether that be substance use in most cases or other behaviors. So anyway, that's it. So let me conclude, wrap things up for you guys. Number one, there is definitely a great need for a brief motivational plus integrated interventions to cost effectively impact multiple health risks that are very common among today's youth and young adults. Number two, the behavior image model and the PPW program logic model are great tools to create and apply brief motivational integrated programs that address substance use and other healthy behaviors for improvement of physical and mental health of young people, more holistic strategy. Research and practice supports the behavior image model for creating and effectively influencing multiple behaviors of young people. So good stuff, I think. Of course, I'm I'm prejudiced, but I think good stuff all around. I think we've done great work over the years. We continue to do what we can to get these programs to you, to help you understand how to use them, to apply them, to tailor them, to improve them, to ensure the greatest benefits for your youth and your families in your region. So you can learn more on our website, preventionpluswellness.com. You can call us anytime right after this webinar at our phone number here in St. Augustine, 904-472-5022. And you can email us anytime at info@preventionpluswellness.com if you want to reach out to us about anything. We're here to help you at any time. And so thank you for your time. So I apologize. I was looking to my right. I had just set up a bird feeder and one of these little red hummingbird feeders. And I'm getting a ton of hummingbirds coming. And it's so cool to see them. So you just mix the some sugar in your water together. And it, I don't know if you have hummingbirds in your region. They're beautiful and amazing, amazing animals. So I apologize for looking over there at my hummingbird. So let's see if anybody has any questions or comments. So we got Erica from Eastern Kentucky. Thank you, Erica. And any questions, now is the time to ask. I know we covered a lot, but you will be getting the slides. You will be getting the link to the recorded session. You will be getting a CE certificate. But was there anything that was that didn't make sense to you? Was there anything that was a little confusing? Did you have any questions about the behavior image model, the prevention plus wellness logic model, prevention plus wellness programs, training, image, how images work, how goal setting works? Any of those things, now is your chance to ask a question, and I'm happy to answer if anybody has any questions. So just want to give you a chance. There's a slide. There's a lot of content there. And I'll be sending that to you guys later today. So you don't have to email me because you'll be getting this. And if you don't get it, check your spam folder because it has attachments. Sometimes it'll be sent there. All right, I don't see anything. So again, I'm going to sign off. Thank you guys. God bless you for what you do for youth and families. You're wonderful. We want to partner with you and help you any way we can. And if there's anything we can do, please do go to our website, preventionpluswellness.com. Even if you don't use any of our evidence-based and evidence-informed brief interventions that integrate, multiple behaviors, there's a bunch of free resources on our website. Just check under the heading of resources, and check it out. Okay. You're welcome. Thank you so much. I hope you enjoyed it. I hope you found it useful. If you want us to address anything else in future webinars, shoot us an email, info@preventionpluswellness.com. Thanks, everyone. Have a great afternoon, great rest of your day. Stay safe. Take care of yourselves. God bless everyone. Thank you. Bye-bye.